All right. So we are joined today by Dr. Lawrence T. Brown. Dr. Brown is a research scientist at the Center for Urban Health Equity at Morgan State University. He is the author of the best-selling book, The Black Butterfly: The Harmful Politics of Race and Space in America. Through archival research, including work with the National Archives and development of GIS-based data platforms, Dr. Brown and his collaborators have examined the enduring impact of the 1930s redlining maps. Their work highlights the extent to which structural racism, as reflected in these policies, continues to shape mental health outcomes today. So we are grateful for Drs. Brown's joining us. And without further ado, please join me in welcoming Dr. Brown.
All right, how's everyone doing? That was a little low. Is everyone doing? All right, Psychiatry Day. Has it been good so far? Oh, you were in for a ride. But I'm glad to be here. Thank you to Dr. Lee and the team here for inviting me to speak. I want to talk to you today about redlining and its implications for psychiatric care. I'm going to dive right in here to this notion that my team and I at Morgan State University, we've come up with called the New Deal mapping state. And what we mean by that is the way that federal agencies during the New Deal, I know this is psychiatry proud, but who's the president during the New Deal? FDR, in the state of Franklin Delano Roosevelt. President Roosevelt, under his administration, and what were they trying to do during the New Deal? I'm a professor, so I like asking questions of the audience. What were they trying to do? They were trying to make the economy, yes, they were trying. It's a trick question, say that. Should I say it? Yes. Make the economy, that's what they're trying to do, make the economy great again. The economy had went into the tubes. Right? They called it Black Monday, October 1929. And so jobs, people were thrown into unemployment. And what are we trying to do with the housing industry, since that's what we're here to talk about today? What happens when they stop lending for the housing industry? People stop, they stop building. So the construction industry, the home industry, thrown into disarray. So getting the banks, rebuilding banks, so that they felt comfortable lending again, that then kickstarted the construction industry so that people, and at that time, you're talking about men in the construction industry, due to the gender nature of the workforce at the time, were able to get back to building homes that we know today. So these are some of the agencies that were involved: the Federal Home Loan Bank, the Federal Housing Administration, the Works Progress Administration. They drew maps for nearly 500 cities, staggering number of maps. And these are the architects of the mapping state. You see Richard T. Ely, he was an academic, first at Johns Hopkins, then he went to the University of Wisconsin, then Northwestern. He really was the intellectual mastermind behind thinking about housing and real estate in a different way. Then you have, let's see, Dr. Homer Hoyt in the middle. He was the chief land economist for the FHA. The chief underwriter is Frederick Babcock. And then their boss was Dr. Ernest Fisher. So they were with the FHA. And then you have John Fahey on the bottom right. He was the director of the Federal Home Loan Bank Board. And then above him was the director of the city survey program that created the redlining maps that we're very familiar with. And that's Core and Fergus. So these, the maps didn't spring up in thin air. It was like Harry Potter getting one together, Expecto Patronum, Expecto Cartography, like the maps did not just magically appear. There are actual people who were God, intellectual thought into creating the programs that really did save the economy. But when they saved the economy, they produced inequality in a massive way. So if you want to scan this QR code, it will take you to my website, which has this infographic. And if you're interested in taking a deep dive into the history of redlining, you can, this will give you the source evidence for all of these numbers on the infographic. Let's just have time for number 4, 6, 8, 11, and 12. That's what I want to highlight today. So let's talk about first the Federal Home Loan Bank Board, this organizational structure, because most scholars, when they talk about the redlining maps, as they're called colloquially, they're talking about the Homeowners Loan Corporation. So you scholars may refer to them as HOLC maps, HOLC, Homeowners Loan Corporation. But this is the chart. And the main thing I want you to see from here is that it's a subsidiary of the Federal Home Loan Board. So when people say HOLC maps, it's somewhat of a misnomer. These were produced by the Federal Home Loan Bank Board, which means those maps were produced by which government? The Afghan government? The Australian government? Which government are we talking about now? Let's be specific. The United States, there you go, this is the United States of America. Federal government, the Federal Home Loan Bank Board drew these maps. And in the 4th annual report, we actually know specifically how these maps got underway. So July 20, 1935, that's when the board met and they decided we were going to kick off the city survey program. And they decided they were going to map and confine their investigation to cities that had 40,000 people. So that was the threshold. 239 cities that met that criteria. So they drew these maps for 239 cities. 40,000 over, the work started in August 1935. Y'all ever heard, let me see, that little project 2025, heard of that? Has anybody? You two, if you three, so 3 people project 2025. My point is, this was actually project 1935. The drawing of the maps, project 1935. We're living in the aftermath of project 1935. And these are some of those maps. You've seen them before. Very familiar pattern, red, yellow, blue, and green. Green representing the most best for green. These are the best neighborhoods. And can I have a volunteer? I need a volunteer. I'm the banker. I need somebody to be my green volunteer. You look like you. So you from the green, the bank. That's what you think you're going to get in a green community, being from the green. So I'm about to say, we're going to give you 2.7% interest rate. That sound pretty good to you? And let's say, does it sound good? You set the terms? My green, all right, my green partner has their home. All right, so I need somebody from the blue. Who's going to be my blue volunteer? All right, looks like I have Evans right here. Now, Doctor, you from the blue community, what do you think you're going to get? 2.7? You think you're going to get 2.7? Well, he's from the green, he got 2.7. So you're going to get a 3% interest rate because blue stands for still desirable, but not the best, right? So still desirable, so you get 3% interest rate. And how about I give you a $400,000 loan to buy your home? Does that sound good? That is our hand. All right, excellent. All right, now I need somebody from the yellow. Yeah, oh, I look like I have a Dr. Lovejoy here. Looking at the sweatshirt. So, Lovejoy, tell me, now we from the yellow neighborhood stands for definitely declining. Definitely declining. So what kind of interest rate do you think you're going to get?
Not as good.
Not as good, so 5%. I'm offering you 5%. Because in the yellow, that's where the immigrants live. You know, the Italians, the the Greeks, the Polish. Those are the immigrants at the time. So, immigrants. So we're not going to give them, not Americans yet. So 5% interest, and you're going to get $250,000 loan with that. Will you accept it? You don't have a choice. All right. The love joy is on. I need somebody from the red. Dr. E. Dr. E, you're from the red. Who's in the red? Black Baltimoreans, people of color. And in 1937, Baltimore wasn't majority black yet. So you have poor white folks. I'm sorry, I didn't mean to be like that. I mean, you're poor, but I mean, just, you know, in this exercise, you're representing a low income white community, right? So, you're from the red? I'm sorry, Dr. A, we don't really lend to folks in the red. So, that's how these maps worked, right? They were determining access to credit. They were determining which neighborhoods were credit worthy and which neighborhoods were not. So you see the map for Brooklyn, Hamilton, Chicago, 239 cities, jurisdiction across the country. These maps were drawn for them. So there's been somewhat of a scholarly debate. Some scholars have said, yeah, they made maps, but they didn't spread them. They just kept them, guarded them closely, and they was just sitting up on the government, never to be seen by private industry, right? So they went through this trouble. And they just kept it a closely guarded secret. And we said, well, let's go to the archives. Let's see what the evidence really says. So here's Exhibit A. In the Federal Home Loan Bank Board's journal, what's the name of the journal? Creative name, right? The Federal Bank Review. They couldn't think of a title, so just use the name. I guess 1936, and look at what they published. It sent us out to their mortgagees, the banks that are part of their foreclosure rescue program. Security maps for analysis of mortgage lending areas. You see the subtitle there, technique for making a security map. And then you see the subheading over there, instructions for making security maps. And at the top of the last column, A, best, B, still desirable, C, definitely declining on the next page, D, hazardous. So what are they doing in this journal article? They're spreading the instructions. Bank instructions. These are instructions so you can make maps just like me, the Federal Home Loan Bank Board. Hey, I'm sending these instructions to the bank so that you can make the maps just like we have. They're giving out instructions for how to create these maps. And they even say here, as a result, several hundred institutions which had never previously considered such an approach to their mortgage problem have begun to develop and maintain security maps. So these were banks that weren't making maps before, but they began to make the maps. They started making the maps after the Federal Home Loan Bank Board's work. So they've done it by the time they read this article, and now they were trying to send out, they said several hundred. This journal would go out to several thousand banks. So they were spreading their methodologies, their technique, spreading even the data that they were using. They were making sure banks understood how to do this. Then in February 1938, in this Time magazine published trade industry magazine called the Architectural Forum, there's Director Ferguson. Look at him. Taking his picture, profile. The profile is creating surveys, and survey probably sounds in today's language more like a survey where you're writing, filling in maybe ABC or something like that. But think of the older use of the word survey. Survey used to be looking at the landscape surveying the land. So in this sense, survey has much more to do with the mapping that's taking place over here. And so they actually put this map, it's a de-identified map. They don't say which city it's from. They call it a hypothetical city, but that's actually the map for Lima, Ohio. So they put the actual map for Lima, Ohio, not these colors, but they had the numerical or the alphanumeric code, so A, B, C, and D. And so they used this to share with industry. And I just found a couple of months ago, I found the dissertation by Sarah Dreller. Her dissertation was on the Architectural Forum, and it talked about their circulation, their readership. Guess how wide their readership was in 1938? Just take a wild guess. No penalties. 1,000? That's all right. Anybody else? 1,000 on once? 2,000. Okay, we got more. So much? That's a lot of people. I got a million, but 40,000 readers. 40,000 readers. So they had a broad subscribership. So this is going out to those folks. And so that's their magazine. Then it was reported in newspapers. And you can see here, a super federal survey of realty and mortgage markets maps 239 city centers. So that was how the Federal Home Loan Bank Board spread their maps. Journals, magazines, newspapers, spread their methodology far and wide. Now the FHA, they also had their journal, Insured Mortgage Portfolio, and they're spreading what they call their block data maps depicted on page 9. So their methodology, they would list statistics in every single block of a city, very granular, very granular. And then the last statistic at the bottom, the percentage of the total number of persons living in the block that are of a race other than white. So the last statistic at this time, Dr. Homer Hoyt, we met him earlier, he would say in his 1939 monograph that the FHA published that around 86% of the non-white population at the time was Negro, which is what people were called at that time, either Negro or color. So if you see race other than white, what they're saying is, like a super majority of the time, we're talking about Black people, so we're just finding a nicer way to say it than saying Black people, even though there are certain maps where they actually come right out and say Negroes are colored. But here you see race other than white. What the FHA want to know, Black people are living on that information. Somebody tell. That sounds be specific than that. Ooh, oh, now we're getting there. Because if you put those two together, look at what they say over here. The mortgage lender considering the house in a high-price neighborhood, for instance, can determine the points at which low-price or substandard structures are nearest, whether or not there's an admixture of commercial uses, and whether there are racial groups in the vicinity. The inharmonious racial groups. I'm curious, well, that's a curious phrase. Anybody ever heard that before? Inharmonious racial groups. So surveillance, I heard that word, they are tracking. This is a tracking map. They're tracking where Black people live, the non-whites. They want to know that. What did the FHA do? Okay, Jay, we told you that the FHA did not lend, but it insured mortgages. This was mortgage insurance. That's what the FHA did, which is close. Right? So they didn't give up the money. My banks. My bank. Insurance. Now think about it. I'm helping to make the economy great again. I'm the FHA. Y'all laughing for it. That's what I'm here to do. I'm the FHA. So I'm making it comments. If you what's going to make you confident in lending? Yes, knowing that if the home, if this is the home buyer, you say, green home defaulted on this loan, you know, as the bank, that the FHA, I will cover you just in case he defaults. That's insurance. So I'm guaranteeing the loan. But at the same time, these maps that my agency, the FHLBB, the maps that we're creating are also saying we will cover. Surely, not so much. So this is the federal government reshaping the mortgage market, structuring the mortgage market, even as it saves the American economy. Here's another map and another issue, not colored, but very similar. And this is a bank map from Los Angeles. And you can see they have 5 different categories in the legend. So subdivision is like a new sort of complex or neighborhood that's being built. So the other 4 decadents is very much like hazardous. D, decline is very much like the yellow, definitely declining. Maturity is definitely like the blue. On the Hawk map, or the Federal Home Loan Bank Board map, would be still desirable. And then growth would be like green, best. So here's the FHA publishing a map in its journal that's very close to the sister agency's map that they were drawing. So they were all invested. That's why we call them the New Deal mapping state. And these are other maps from the 1939 monograph I was telling you about, Dr. Hoyt wrote. So basically, I just spent this entire 20 minutes or so just to really sort of substantiate and outline that the federal government, our government, in America, if you grew up here, this country spread these maps to the mortgage lending industry, to the building and home construction industry, to the real estate industry, to the appraisal industry. So this is shaping housing around us. Thank you. So disappointing. I gotta stay close. No, you good. So, say it again. You don't want me to try that? Let's see. Always like having options. Actually, I like this one though, because I think if I turn this one, I'll have to turn the other one off. No. Good deal.
All right, all right. That concludes part 1 of my presentation. All right, so part 2, thank you. So basically, this is what I just explained. The FHA was shaping loans from the inside. The Federal Home Loan Bank Board, they weren't lending, but they influenced private industry on the outside of the industry. So they had this inside-outside effect on housing, finance, urban structure of cities across the country. So part 2, how does redlining impact health? So I know this is a psychiatry group, but let's take a look at other disease conditions first. So here's asthma. Where's asthma the highest? Right? You see that stair-step pattern? Where it's highest in the red, then yellow, then blue, then green. We call that monotonic. That's a monotonic stair-step pattern. 80 years, 90 years later, this is what we see in terms of ED visits based on asthma in cities across the country. Here are cardiometabolic conditions, whether it's diabetes, obesity, high blood pressure, same monotonic stair-step pattern. Here's breast cancer. The highest probability of survival are for patients in the green, then blue, then yellow, then red. Air pollution. If we look at Baltimore on the right, communities in the red have the highest air pollution, then yellow. Blue and green are that blue might be a little bit lower, so it may not be the stair step monotonic, but it's very, very close. Even if it's not exactly 100% monotonic, the same basic sort of pattern is there. Tree canopy. Any tree lovers in here? Thank you. Any environmental lovers? Anybody hugged a tree lately? All right, there you go. So look at these cities, more tree canopy, higher amount of tree coverage in all of these cities. And then stair step pattern going down. And so you see that redlining maps, and the technical name of these maps were residential security maps, that these maps were shaping the structure of our cities, the infrastructure, the exposure to pollution, the survivability from diseases like cancer. The structure of those maps are still impacting. Look at the urban heat island effect. Hotter in the red, then the yellow. Look at how cool it is in the green. It might be those trees. Exactly. If you drive in Baltimore on Roland Avenue, compare Roland Avenue to Fulton Avenue. And if you drive, or if somebody's taking you, just take a look at the trees in the middle of the road. Not only the number of trees, but like the height and the coverage, the canopy of the tree. Just take a look at that, Fulton versus Roland, and you will visibly quickly see what these slides are talking about. And those trees absolutely help make sure those communities are cooler in the summertime. So how does redlining impact health, mental health? So here's a paper by Amber Pearson and her colleagues, and they really sort of outlined that redlining and this is modern, contemporary redlining, would be impacting the way people, how close folks in neighborhoods are, the cohesion in neighborhoods. They say it would impact the neighborhood aesthetics and then also experiences of discrimination, and that through these mechanisms, that would impact mental health outcomes. So, and I talk about this in my book, this eco-social model of Black neighborhood destruction, because I think a lot of what I've discussed is really predicated on racial segregation. Racial segregation being such a heavy reality in Baltimore City. In fact, the sociologist Douglas, Nancy Denton and her colleague, they basically found that they had like 5 different categories for racial segregation in cities. So category 1, low segregation, category 2, moderate, category 3, highly segregated, and categories 4 and 5 are hyper segregated cities. Guess which category Baltimore is in? Category 1, 2, 3, 4, or 5. All right, so Baltimore is a category 5 hyper segregated city. What else do you know is referred to by category like that? Category 1, 2. Hurricanes, right? So think of that analogy. Baltimore is akin to a category 5 hurricane in terms of its destructive implementation of racial segregation. Baltimore has among the most intense forms of racial segregation in America, along with 7 other cities that you might be familiar with: Chicago, Flint, Detroit, Birmingham, St. Louis, Milwaukee, and Cleveland. Add Baltimore, those are the top 8 category 5 hyper-segregated cities in America. Do those cities have problems from your astute study of the nation? Are they associated with any issues? A few, right? And so I'm suggesting to you that one reason this is the true is because of racial hyper-segregation. And what happens when communities are hyper-segregated? What happens to them in terms of the resources? And what happens to them in terms of Black neighborhoods? So this model here that I explored in my book was really just talking about how throughout time, Black Baltimoreans were just uprooted and pushed out and displaced over and over and over again. Now, I'm sure y'all study Dr. Mindy Thompson Fullilove, or Dr. Mindy Fullilove Thompson. I forget which the order is, right? Now, what is the theory that she came up with to really describe what happens to people that are uprooted over and over and over again? 2 words. She called it root shock. Root shock. When you repeatedly uprooted people over and over again, root shock, where does that come from? Yes, like a tree or anything that you plant in the ground, that when you uproot it and you remove something from its natural soil or habitat, what tends to happen to those trees if you were to do that? Uproot them from the soil, right? Flagging, weaker. Even if you replant it in new soil, right? Anybody love plants in here? I know my tree lovers were earlier. Oh, you're a plant lover too? Okay. All right, Dr. Lovejoy. That's why Dr. Lovejoy loves the plants. All right. So yeah, what happens when you repot that old plant into new soil? They don't always survive, right? So I'm highlighting this because when we often talk about racial segregation, but I think this root shock is something that we do not normally discuss. And I want to just highlight in the middle, urban renewal in Baltimore specifically. So these are files from the Enoch Pratt Central Library. And you can see this map is showing where urban renewal took place in Baltimore between 1951 and there are several other displacements on here, but mostly between 1951 and 1971. And so you see, where was most of the displacement taking place in Baltimore? In the middle, yes. Not to the north, not a lot in South Baltimore or the peninsula, but in the central part of the city. And what you see, and this is my handwritten annotation, so excuse a bit of a scribble, but you see the University of Maryland. How many households were displaced for the benefit of the University of Maryland? Over 1,000 households. Don't worry, you're not the only one. Let's look at Hopkins on the east side. Hopkins got you beat. 1,335 households for dear old Johns Hopkins. So this is highlighting that our universities, historically segregating universities, have been involved in urban renewal and displacing people in communities. And we actually have the data here from the Baltimore, it was first the Baltimore Urban Renewal and Housing Agency, BURHA, then they became the Baltimore Department of Housing and Community Development, DHCD. And look at how many thousands of households were displaced in Baltimore City. 16,505. That's just households. How many people were living in each household? Right. So we could be pushing 80,000. And I think that's relatively conservative because a lot of families were much bigger back then. And look at number one, relocation affects far more non-white households than white households. So this, not only was urban renewal happening in Baltimore in a very intense way, it was disproportionately impacting its Black residents. And so we have quantitative documentation. Also want to highlight that redlining is still going on. Here's a graphic from a study by Be More Collab. If you want to look up on your phone, there's a scholar named Mac McComas, at Johns Hopkins 21st Century Cities Initiative. And you can see the white L, the black butterfly, that's the descriptor that I coined back in 2015. Look at the total amount of loans received in this roughly 10-year period, 2012 to 2022. Whereas the black butterfly, which has roughly 2/3 of the city's population, received $1.3 billion in loans. The white L, which has only 1/3 of the city's population, received $3.1 billion in loans. So look at the level of that disproportionality. And so in other words, this is highlighting that redlining is not an anomaly, like, oh, this just happened way in the past. Nope, still happening, still going on. And if we look at the top 13 neighborhoods in terms of the amount of small business loans they received, none of them are in the black butterfly. All top 13 neighborhoods are in the white L. And if you look at the bottom 50 neighborhoods, 47 out of 50 are in the black butterfly. So this really highlights numerically the disproportionality. And this is the map. This is the map. From 1937, Central East and Central West Baltimore, and then covering the peninsula, Locust Point, Southwest, you see Pigtown, and you see how the neighborhoods were colored on this map. Now, who created this map again? I just want to make sure we're sure on this. The US government, all right? We'll make sure we know. Our government, United States government, created this map. Who was involved in urban renewal? Make sure y'all was listening. Who was involved? Now, don't say us now, because you weren't alive and the entity did it, right? The entity, the institution did it, not you individually, the institution, right? So, but University of Maryland, Johns Hopkins, and this is happening all around the city. Even the highways, I-83, 260 households to build that, routed through the center there, and US 40, sometimes you hear called Highway to Nowhere, almost 1,000 households running through West Baltimore. So infrastructure, as it's being built in the mid-century, is just uprooting and displacing Black Baltimoreans over and over. So mental health, from a study by Elizabeth Murphy, the bigger the dot, the darker the shading, the higher the level of poor mental health prevalence. Do you see a correlation here? Do you see a pattern that stands out? Or is it random distribution? Oh, you see two patterns. Because the first pattern is in the red neighborhoods, there's a higher propensity for low mental health outcomes. But you also see the black butterfly pattern, especially if you look in the middle of the city, come down the middle, and then Alexander Street, go east, that they're lighter shading, smaller dots. So this actually reveals two patterns. The Hulk map, the Federal Home Loan Bank Board map is there, but then also the black butterfly white L pattern is there as well. So we're here to celebrate Cultural Psychiatry Day, right? Well, I'm here to suggest that maybe we should rethink who has a culture of sickness. Because a lot of times we want to label people with all kinds of diseases y'all know about, because y'all study this thing in psychiatry. What are some of these diseases y'all be talking about? Depression, schizophrenia, bipolar, addiction. Yes. So this is what you diagnose, right? But I'm suggesting that perhaps we have a culture of structural gaslighting. And that the institutions, and I'm also an academic, I'm at Morgan State University. I'm in the field of public health. So I ain't talking about public health today, but believe me, public health is implicated in all of this. So as academics, as professionals, in training. Maybe we need to understand how our institutions perhaps have inflicted trauma and how our institutions are structurally gaslighting our clients, our patients. Because what does it do to a client when you don't acknowledge their reality? When you don't acknowledge their history? When you don't acknowledge their truth? What would that do to you if you came to school every day and nobody was telling the truth? All right, stop trying, stop trusting, stop asking for help. You question your reality. You repeat the mistakes. Oh, yes. So if we have to question whether or not we are perpetuating our institutions. We should be questioning whether or not our institutions, our curriculum, our classwork, and we're living in a country right now. Oh, I got to tell it. Thank you. We're living in a country right now. Oh, that denies the truth. Not only denies the truth, it is actually trying to undermine the pursuit of truth, the study of truth, of getting at the history of what really happened. And it's not meant to demonize any people because nobody was alive when those maps were drawn. None of you were in the room when those maps were drawn. So this is not about, I'm trying to blame anybody in here. That's not what this is. This is how do we tell the truth so that we can heal our patients? How do we tell the truth? And I heard the presenter before talking about refugees, right? Talking about different populations. How can you deal with any group of people and you don't know how they've been uprooted from their country, uprooted from their location, previous location? Would you allow an immigrant to come into your practice and not understand anything about their history? If they were Rwandan or from Bhutan, right? If they were from Nepali, if they're from any of those backgrounds, you wouldn't just say, well, I'm just here to treat you, the individual. I'm not concerned about your history. I'm just going to treat you like everybody else. Well, people aren't like everybody else. People have been through different things, different contexts, and we need new systems. Do y'all do charting? I know the medical folks do charting. Do y'all do charting? A lot of it, all right. Does your charting incorporate this information? Does it help you to understand who's coming from green, blue, yellow, and red neighborhoods? It could. Is it helping you to understand which patients have been uprooted, family history, over and over and over and over again? Do you have a system to do that? All right, and that's real, but what if I told you that those maps were algorithms as well? And even before AI, we human beings have put together algorithms that structurally disadvantage. So yes, we need to be concerned about AI, but I'm telling you that we've been using algorithms for 80, 90 years and not questioning, hey, where does this data really come from? What's really the driving factor behind the data that we're seeing with our patients? And what role are we playing, perhaps, or have we played in producing those outcomes? So that's all I got. Appreciate y'all. Thank you so much. Glad to be here.
Any questions?
How do we get this information out to the general public?
Oh, was that someone online?
See,
All right, how do we get this information out to the general public?
Yes.
This will be the topic of my next book. But I think before that, well, I mean, I've created a board game, educational board game that kind of really illustrates this called Urban Cipher. It's another great educational tool. But I think if I hear your question correctly, these are things that we're going to have to teach, and I think we're going to have to start teaching them not just when folks get to college. This needs to be, I'd say, middle school, maybe upper middle school, because I do believe in age appropriate. I don't like scaring children in second grade. Yes, look at this map. I don't believe in that. All right. You know, a seventh or eighth grader with the right teacher, they can handle it, and certainly high school. Because everybody's not going to go to college. So I believe we're going to have to rethink our educational curriculum. And then certainly, I think when you get to college and our university institutions, we should be teaching, you know, now get into some of the historical detail more in depth, as I explained here. How many, this was your first time hearing this information?
Mine.
That's good, right? So that's good that if this wasn't your first time, did you know the names of the guys, the architects? All right, you didn't know the names. Did you know it was the FHA and the Federal Home Loan Bank Board? All right, so you like kind of knew some of the details, but you didn't know like the specifics. That's what we need to change. That's what we need to change. So that would be my answer. I thought you and then you, yes.
Well, as an aside, I think kids in Baltimore City schools, even much younger, are learning this, even if it's not explicitly being taught. But I think even at the like having a fifth grader going into middle
Yep.
school and the choice thing is already very clear. But my question was, you have me thinking about trees. Dutch elm disease hit Baltimore a similar time, and the parts of, you know, the black butterfly are still like just devoid of trees, especially on the east side. And so was that something that like, I mean, like how did the two, did they plan around it? Or did like plans change when certain areas lost the trees?
I honestly don't know that history specifically. It's definitely worthy of investigation. And if you look at the United States Department of Agriculture Forest Division, what was that? USDA Forestry Division. I think they have research on that probably more specifically where they could outline sort of that sequence and the role of like what was going on with that. Absolutely. I saw the lady in the back and then I see the folks on the side. I saw your hand first, yes.
And we got it. And so I just really appreciate your
Oh,
support. Thank you so much for all that you do.
thank you. Thank you.
I have a question, another question.
All right, tell us your name,
Calix.
Hey, Calix.
I wonder because I love this phrase of structural gaslighting.
Don't
Especially,
y'all be using it now, not
No.
telling folks that it was Dr. Brown who came up with it.
yes, structural gaslighting. So how can non-Black people engage in decolonizing themselves to then undo the structural gaslighting or the tendencies that drive structural gaslighting?
Sure. Well, the first thing is everybody needs it. Everybody needs to know the history because you can have Black people in leadership positions that can perpetuate the same systems just like anybody else. So, yes.
Good, thank you.
Yes, we understand that folks who aren't from the community, folks who don't have the lived experience, maybe are more likely to cause a certain kind of harm. But let's just be clear that, you know, it's not just non-Black folks who can cause harm. Any group of people can actually perpetuate harm against their own group of people. And that's an unfortunate truth, but I think we need that nuance. We need that caveat so that we're not just practicing a sort of form of essentialism that I think
is harmful for where we need to go.
Okay. With
Thank
the
you for that
second
question.
part, what are some decolonial tactics or suggestions that you would have for all of us to decolonize our minds?
Education, number one. Folks need to be well read, well studied. But then also you have to have a commitment. You have to have a real commitment to analyzing and understanding what I just said, which is really the harmful impact of policies, practices, systems, and budgets. These were structurally damaging, traumatic, trifling policies, practices, systems, and budgets, right? So, in other words, I want people to think not just in terms of how people manifest the different conditions y'all mentioned earlier, but think about how systems are also inflicting the harm, the damage that help to facilitate more people, especially in those red and yellow communities, now exhibiting those conditions that we see today at a higher rate. That it's not just the notion that it's not just their fault. It's the environment they lived in, and the environment was shaped by those maps that were produced by our federal government. Thank you. In the back, yes. And I'm gonna come to this side of the room. I ain't got to this side of the room yet, but yes.
Thank you for your talk. That was really informative, and you're a very engaging speaker.
Thank you.
I did want to ask about your thoughts on the focus on maybe economics as an overarching theme, which may be more palatable to more people. And as an example of that, I was thinking of the example of Baltimore. You mentioned displacement. And I was thinking of it as an outsider. I would want to develop the more underdeveloped parts of the city so that there's employment, it improves the security. Logically, it seems to make more sense. And I imagine, say, John Hopkins was built up in Towson. The narrative could then change that we're building these institutions in mostly white and wealthy neighborhoods. You don't have access to it. So just wondering what your thoughts are on that.
Wait, I heard economics earlier, but that last part.
Yeah, just the idea as a concrete example of the narrative that there's been a lot of displacement in the center of the butterfly. It seems to me that there's a lot of benefits that have come from that, which is jobs. It's probably decreased crime in the area, and is developed in underdeveloped part of the city, as opposed to building it in, say, Towson, which is already developed. There's no point in doing it. And then the narrative could change that, oh, it's serving the wealthy and the white neighborhoods.
Right. So I think we don't have to have an either or scenario. In other words, I think we can have both the idea that, well, and before I go there, the first thing is we can acknowledge that these institutions have done good things, done great things, right? So none of this is to discount the medical discoveries, the jobs, everything that I think the institutions do a great job at doing, the trauma care services, things of that nature. But what I'm saying is more so that, and the flip side is these institutions are also receiving tremendous tax breaks. They're also, and then therefore not paying into our general fund the same way that other corporations or institutions should or do, are mandated, required to. So it's not just that they're doing good, but they're also receiving a lot of services from the general public. And so they have an obligation, I think, to make sure that not only that they're treating communities well, but then they also address the harm they've caused historically. So that would be my answer to that. I'm gonna come to you, but I didn't answer nobody's question over here on this side. So did anybody have any questions? Yes.
Hi, thank you so much for this really great talk. I have a comment and then also like a general question.
Yes.
My comment, I guess, is to just bring a little bit of attention to like racial segregation in mental health and especially in Maryland. Something that I've I guess, gotten another talk on recently and I've been thinking about, but like going back to, I think it was Samuel Cartwright, like this concept of drapetomania, and essentially like the idea of pathologizing like an enslaved person's desire to be free, and then the eventual creation of Brownsville Hospital, and the fact that like we in our day-to-day, actually with a lot of our older patients, come across people who were treated at Brownsville Hospital as well. And my general, so it feels like we're just like working in this system that's like a remnant of this like kind of darker history, right? But my question comes to this like stuff you talked about at the end. It's actually maybe a little bit more for our community psychiatrists. But I'm wondering, because you asked about like documentation and if we are documenting on like the systems part, and I'm wondering how our psychiatrists are like navigating that, because I'm still in training. And I guess this can be, if anyone has thoughts afterwards, you can come to me. Thank you.
That's a good question. And my short answer is if you don't have the intake systems that account for this history yet, then we need to build them. One of the main things I would collect, I would have, unless you have someone like an intern who can go and look at every single person's address, have some sort of GIS system that you can do it that way, right? You can always do it manually, but I'm saying in the software world, there's GIS, geographic information systems, that can geocode where folks live and then match it to, like, are they coming from red, yellow, blue, green? And then, yeah, like just to understand, like, all right, this patient's coming from a yellow community. Now, that's like just quick and dirty, but I think where we need to go is not just that, but also family histories. And again, because if you have like the great grandmother that went through the process of, this was the federal name for it, slum clearance, 1930s and 40s. The great grandmother went through slum clearance in Baltimore, right? Then the grandfather went through urban renewal. Then the 1990s, the mother went through the demolition of public housing, displaced then. And then today you have your patient and they've had a forced eviction. And being able to capture like 4 generations of forced displacement. I mean, because psychologically, which is what you are really dealing with, what is that going to do to people's ability to perceive the world when 4 generations of their family have been uprooted over and over and over again? That's where I think we really need to go. That root shot. I really think, and I'm not a psychiatrist, I'm just an old public health researcher. But I think that when we talk about a lot of these conditions, people's not having the context and the memories, the community, the ties, the bonds that they had, and they've been uprooted repeatedly, that's really, I think, underlying that, plus the redlining, the poverty. And when I talk about urban renewal happened in those redline communities. So that's the other things, that redlining is sort of the baseline, it's the matrix in which a lot of these policies, other policies, are unleashed. So we have to have some sort of intake system that can really capture like these histories. And the only way you're going to get that, you're probably not going to get that from a survey. You're probably going to get that from people telling their stories. And the only way people are going to tell you their stories is if they trust you. So you can build a system, but you got to have trust. Trust is still fundamental. So that's the way that's kind of the secret sauce. But if y'all want somebody to build a system, you can hire me and do it. Yes.
With the Voting Rights Act, that
that last part kind of threw me. How does the Voting Rights Act impact? Well, you know, any policy, when people aren't able, especially people who are from the, we can be clear that the people that will impact the most are people living in like red and yellow communities. So then their concerns don't get to be reflected. Their housing concerns don't get to be reflected in policies that are passed. I will say this though, I think a lot of things that are being done might be, there might be a backlash. Like, I don't think that, like, if in other words, if there's a surge of voting, it can overcome and defeat, I think, a lot of things to undermine voting rights. So I wouldn't let what they're doing be the last word. I'll be here for a couple minutes.
I just want to say the most hearted thank you to Dr. Brown. We can continue to ask questions, but this, I think, will conclude the grand rounds portion. For those online, thank you for joining us. And again, thank you for enlightening us on a lot of really important matters.
Thank you so much. Appreciate you.